Hey guys, this audio lecture is going to be about Chapter 19, Contrast Media and Special Radiographic Techniques. So like always, I want you to make sure you know the key terms, define all the key terms in the chapter, list the potential adverse reactions that may occur after IV contrast, describe how to take patient history for various IV contrast exams, name the blood tests that may be used before an IVU and administration of iodinated contrast. Describe how contrast is introduced for various exams. Know the differences between iodinated, ionic, and non-ionic. And then review the exams at the end of the chapter. You're going to be talking about these in your procedures class, in your advanced medical imaging classes. But I do want you to go through all the major exams and be able to define what they're evaluating, what anatomy are we looking at. So remember that our contrast agents, our barium, our water soluble, our air can all be broken down into positive or negative contrast groups. And this is based on how they appear on an X-ray. And how they appear on an X-ray is based on the substance's atomic weight or the mass density. So the higher the atomic number, the more X-ray photons are going to be absorbed. So just like bone, it's going to appear white. The lower the atomic number, the more X-ray photons will penetrate through and therefore a darker appearance. So think about air. Air is very low density. Air, CO2, oxygen has a low atomic number, and so therefore more X-ray photons are going to be able to penetrate through it, reaching our image receptor and therefore having a darker appearance on our film. So let's take a look at our periodic table here. Note that our common gas for a negative contrast agent in medical imaging is going to be CO2. So if we look at carbon and if we look at oxygen on our periodic table, we see that they have lower atomic numbers, and thus they're going to appear dark on our images. They're a negative contrast agent, they have lower atomic numbers, they're going to appear dark because more X-ray photons are penetrating through, have the ability of penetrating through them. Then if we look at bone, which is made up of primarily calcium, we see the atomic number of 20 and the atomic mass of 40, and so it's going to appear bright. It's going to appear white on our image because it has that higher atomic number. If we go through our periodic table to look at barium and iodine, we see that they will absorb even more X-ray photons because of their atomic mass. So they're going to appear even brighter than bone because less X-ray photons are going to have the ability to penetrate through it, therefore being absorbed, therefore appearing bright or white on our image. So again, the most commonly used gas or negative contrast agent in medical imaging is going to be carbon dioxide. CO2 is going to be used for our double contrast studies of the GI. Gas may be introduced via a pump for a BE or potentially digested gas crystals for our UGI, those pop rock crystals that our patient drinks and allows the stomach to expand. Occasionally, a radiologist may opt to use air as the contrast agent for an arthrogram or a myelogram. While this is not common, it's important to review each hospital's protocols for these exams because maybe there's a radiologist that does like to use air instead of an iodinated contrast media agent for those two exams. Alright, so our iodinated contrast media. This is our water-soluble contrast media that we talked about in our last lecture. So iodinated contrast media contains iodine, which has a high atomic mass and a high atomic weight. it's higher than the atoms that make up our anatomic structures, and therefore it's going to be very obvious on our X-ray images. It allows for easy visualization within the body. So if we look at this KUB, we see that there's iodinated contrast within our kidneys, ureters, and our bladder. And notice how it is brighter than our bones because iodine has a higher atomic weight than our bones, than calcium. Iodinated contrast agents are considered aqueous, meaning they are solvent in water and therefore blood, since blood is primarily made up of water. So this contrast can be absorbed within the bloodstream, and that allows us to use it for potential perforations or injecting into our vessels or into other bodily structures. This type of contrast is only going to remain visible within the body for so long because it's traveling through the bloodstream. It's going to become diluted and it's eventually going to be excreted via the urine. So timing of our medical imaging exams using iodinated contrast is very important. Most iodinated contrast medias are injected. They're going to be injected through an IV, intraarterially, or directly into the area of interest, like a urinary catheter or female reproductive organs. Now, your book does state that all iodinated contrast agents must be injected. However, there is an exception. Do you remember that exception? So gastrographin. Gastrographin is our exception. It is a water-soluble iodinated contrast. However, this contrast cannot be injected. This is only used for rectal or oral administration. So this is going to be used for evaluation of our GI tract when barium can't be used. So I'm not quite sure why your book says all iodinated contrast medias are injected, because gastrographin is iodinated, however, it cannot be injected, and that's just because of the composition of it. It's a really sticky material. So again, we're only going to use gastrographin when barium sulfite isn't a feasible or potentially it's a dangerous option to evaluate our GI tract. So iodinated contrast are carbon-based compounds with iodine atoms, and it's the iodine that provides the radiopaque appearance. There are many different types of iodinated contrast medias. They all have various characteristics based on things like the concentration of the iodine, the osmolality of it, the viscosity of it, the toxicity. Most of these traits do correlate to one another as well. So the amount of iodine atoms within the molecules that make up the contrast vary, and this is called the iodine concentration. Contrasts with a higher concentration of iodine atoms are going to be thicker or have a higher viscosity. So if you look at the animation, hopefully it's working, the liquid on the left has a lower viscosity, and the liquid on the right has a higher viscosity. If these were iodinated contrast, the one on the left would have a lower concentration of iodine atoms within its molecular composition. The contrast on the right would have a higher concentration of iodine atoms. The amount of iodine also influences the toxicity of the contrast agent. The higher the concentration of the iodine, so the more iodine atoms within the molecular composition, the more toxic the contrast is considered. So if we have an increased concentration of iodine, we have a thicker contrast agent or an increased in viscosity. don't confuse viscosity with velocity, two different things. So the viscosity of a contrast influences the flow rate of the contrast during an injection. It can also influence the injection time. So if we want that contrast to end up in a certain location of the body, let's say the kidneys, according to the viscosity of the contrast, that's when we know when to inject and when to take our images. The viscosity also influences the needle gauge that's required for the injection. So potentially we need a larger gauge based on the viscosity. Many times contrast agents with higher viscosities are going to be placed in a warmer to get that substance to room temperature or body temperature. The increased temperature does decrease the viscosity of the contrast. So osmolality refers to the number of particles in a solution per kilogram of water. So we're talking particles, think of the number of atoms in a structure. So remember that iodinated contrast agents are not just made up of iodine atoms. There are other atoms that make up the molecular structure to that contrast, but it's the iodine atoms that make it radiopaque. So each contrast has a different molecular composition or various particles or atoms. So if the contrast is made up of molecules with multiple particles or multiple atoms, it's considered to have a high osmolality. So if we look at the top molecular structure on this image, that has more particles, more atoms within the molecular composition. Therefore, it has a high osmolality. If the contrast has fewer particles, it has a lower osmolality. So this bottom picture here, we have the same number of iodine atoms, but the whole molecular composition has fewer particles, fewer atoms, and therefore has a lower osmolality. So the more particles, the higher the osmolality, the more toxic the contrast is considered. The fewer particles or the fewer atoms, the lower osmolality of that contrast agent, and therefore it's considered to be less toxic. So all of our iodinated contrast medias can be absorbed within the body. They're soluble in water, so if they enter the bloodstream, they're eventually going to get filtered out through the blood. However, iodinated contrast agents may interact with the body in different ways, in additional ways. So our iodinated contrast media can be broken down even further into ionic and non-ionic. Right, so we have our iodinated contrast media. That's always going to be a positive contrast agent. Our iodinated contrast medias contain iodine, and therefore they are always positive. They are always going to appear white on our image. But iodinated contrast medias can be broken down into ionic and non-ionic. Ionic refers to ionization, and we've heard that term before. So ionic iodinated contrast molecules will separate into two charged particles once they're placed in a solution. So if our little iodine molecule, here's our little orange molecule, goes into our blood, it's interacting with a solution, that ionic contrast molecule is now going to separate, once it's in the blood, into two charged particles. It's going to go through ionization. Right, again, so our ionic contrast is going to be introduced into the bloodstream. It's going to go through ionization once it's placed in that solution, our blood, and it's going to separate into two charged particles. Okay, so now we have our non-ionic contrast. It's still considered an iodinated contrast. It's just it's a category within our iodinated contrast. It's non-ionic. So non-ionic contrast will remain intact. So when the contrast molecules are placed in the solution, blood, they're going to remain intact. So here goes our non-ionic contrast molecule. It's interacting with blood, and then it's remaining intact. No ionization occurs. So what's the point of having ionic and non-ionic contrast agents if they're both iodinated, if they're both positive contrast agents, and both water soluble? What's the point of having two different ones? Well, it's the chance of allergic reaction. So if if patients are going to have a reaction to iodinated contrast agents, they're more likely to have a reaction to ionic ones compared to non-ionic iodinated contrast agents. And that's why patients with a higher risk to potential reactions, maybe they're in poor health, maybe they have had contrast agents or contrast reactions before, maybe they have kidney issues, then they're going to be given this non-ionic contrast media because there's going to be a less likelihood to reactions. So why don't we give non-ionic to everyone? It's that little thing called money. Non-ionic are going to be more expensive. However, newer contrast agents have been developed over the last few decades that are cheaper, less toxic, and therefore less likely to have an adverse or an allergic reaction. Um, so while ionic iodinated contrast agents are still being used, non-ionic, although they do tend to be more expensive. Over time, we have actually seen that price drop with research and development for non-ionic contrast agents. So non-ionic are becoming more widely available, cheaper than before, and so you're going to be seeing those more often in clinic now. So again, remember that we have our water-soluble iodinated contrast, and that's broken up into two categories, ionic and non-ionic. All right, so again, almost all of our iodinated contrast agents are going to be injected except for gastrografin. That's always going to be oral or rectal for the GI system. But how we inject it varies depending on the exam. So we could inject it manually by hand, slowly over time. We can inject it into an IV, we can inject it into an artery, we can inject it directly into the urinary system or reproductive organs, just depends on what we're visualizing. The contrast can also be injected all at once as a bolus. So with a bolus, with that large amount of contrast being injected all at once, we always are going to use a power injector. So a bolus can't be administered via hand, so a syringe into an IV. We're going to use a power injector. It's really important to get the timing right or you're going to miss it on the image. This is mainly going to be used with CT or MRI. You're going to start the IV on the patient, connect the power injector with the contrast in it, and then you're going to go back to your MRI or CT scanner, start scanning, and from that control console you can actually start the power injector and the injection is going to start. You don't have to go back into the room. Notice how there are two plungers on your power injector. You always want to inject saline first, and then your contrast, and then saline last. So one of these plungers is full of contrast, one of these plungers is full of saline. The composition of the contrast, so the osmolality, toxicity, concentration, viscosity, all influence how the body reacts to it. The osmolality affects the tissue response to the osmotic pressure. So the higher osmolality may cause blood cells to actually dehydrate. Non-ionic contrast, that is the contrast that undergoes the ionization when introduced into the body, also affects toxicity. The increased number of charged ions can affect the central nervous system. This would cause a more severe reaction to the contrast media, like seizures or cardiac issues. So again, remember we have our ionic contrast. When it's introduced into the body, it's going to separate into our charged ions. Well, now that we have these additional charged ions, it kind of messes with our central nervous system. And just depending on the body, that depends on if your central nervous system is going to react. Is it going to cause some cardiac issues in response to those additional charged ions? Whereas if we have the non-ionic contrast, our contrast molecules going to remain intact. There's no additional charged ions introduced into the body, and that's why we have there's a less chance of an allergic reaction with our non-ionics. Sometimes the body will naturally produce histamine in response to the injected contrast. The histamine is produced as an immune response because it regulates physiological function. So we're introducing this foreign substance. Our body doesn't know what to do. It's going to start an immune response. It's going to make this histamine, and that histamine, when it's released and it's not necessary, may produce negative effects that results in an allergic or an anaphylactic-like response. The toxic effects, remember we've talked about the toxic effect before, may occur because of the amount of contrast introduced into the body. Maybe too much contrast was introduced, or maybe that patient has poor kidney function and so the kidneys aren't able to filter it out. This is why it's really important to document how much contrast you introduce into the body, into the patient's notes. Why it's really important for medical facilities to correspond with one another and to let them know, hey, we just did a CT with contrast. Let's not do another medical imaging exam with contrast and order another one tomorrow with contrast. Again, this is why a solid patient history should be taken prior to the administration of iodinated contrast agents. Because iodinated contrast is filtered out by the kidneys, it's really important to ensure that the patient's kidneys are functioning properly. What blood tests do we use for kidney function? BUN, creatinine, and GFR. So these are all tests that could potentially be done prior to administering contrast. It's the responsibility of the technologist to check what your hospital's protocols are so you know which blood tests to look up, so you know when to look up blood tests, so you know to red flag if any blood tests have not been done. Any abnormal blood test results should be reported to the radiologist prior to the exam. And here she's then going to determine whether or not to continue with the exam or potentially continue with modifications. Patients who have diabetes may also have an poor kidney function. So some diabetic medications like metformin's a very common one, should not be taken 48 hours after the administration of iodinated contrast. And that's because the metformin influences the filtration rate of the kidneys. So if our patient had a CT scan with our iodinated contrast, they take metformin, their kidneys might not be able to filter out that contrast because of the medication. And therefore a toxic effect could occur because that contrast is just staying inside the body. Patients with numerous allergies may have a higher risk to iodine, so you want to say, do you have any allergies? If they're listing off 10 different allergies, talk to that radiologist. Iodinated contrast agents are also natural vasodilators and therefore can increase blood pressure. So if our patients already have a history of heart disease or heart problems, iodinated contrast media could potentially cause issues as well. So who injects this iodinated contrast? Well, almost always it's the technologist who injects the contrast for MRI or CT. When administering contrast for various x-ray or fluoro exams, it's more common to have the radiologist or the radiology assistant or the radiology nurse be the one who actually injects or administers the iodinated contrast. However, this is site and state dependent. So depending on where you work, this can very much be a part of your job to inject the contrast. Some states do have regulations regarding who is injecting the contrast or who's available during the contrast injection. I know when I worked in the state of Texas, the technologist administered the contrast agent, but you had to have at a minimum an EMT available in case of a contrast reaction. Here in Colorado, most clinic sites will stop contrast exams once their in-house radiologist or physician goes home. And that's because, yes, X-ray techs, we're trained for emergency situations, but if our patient has a contrast reaction, we want someone who is fully trained in emergency response to facilitate to help that patient. And so it is, most states you are going to see this law where if you don't have a radiologist, if you don't have a physician, if you don't have an EMT, you're not administering iodinated contrast. Right, you're going to be covering the exams described in the remaining portion of this chapter in your advanced procedures class. But I do want you to read through this last half. Please know what anatomy the exam is evaluating and define those bold key terms within the remainder of the chapter as well.